Hey Dave, thanks for being on Zoom. I was just telling folks that my previous class was taking an exam and ran a little long. So that's why I'm running a little behind. And what I thought we'd start with today is the case study, which is chapter 19. It's the case of Kate. Just to give us another good example of a recovery of function case. Day, I'm not going to make you do a section on your own, so you can just sort of chill unless somebody else shows up, and then I'll put you in a group. So let me see. Would you rather be in pairs or like skipping through maybe split? Probably. Y'all two, do you identify the author's background and history? And then on the no, system and testing results. And then I'll have to review maybe diagnosis and impact on life and family. And then Brittany, and you guys will do a treatment and a and then if people come in, I'll just have them during the group. Chapter 19, and I just realized I did not bring the markers, so I'm going to run back to my office and grab those. I will be right back. If anyone needs my copy of the case study book, I have it here. All right. So we've got folks just finishing up, and then we will be walking through the case study. So I've got my Zoom going. I've got it highlighted over here, spotlighted, so people will be able to see it. And I'm going to turn off my video on the other one so you don't see two of me. Alrighty. So I'm walking across here and go ahead and rotate my camera and have our first group walk us through our identifying info first.
and that removed basically her entire left hemisphere. And then after that, she completely seizure-free after her last operation.
And what's her name, sex? Did it give an age? I don't remember. 25? Okay. 45. Okay. Okay. Perfect. Thanks. All right. And background and history.
She fell from her cot. Her cot and then hit the side of her head, which caused right. And then they think that's what caused her to be left-handed. And then 5 years old, she had another fall, and the EEG showed some seizure activity in the left occipital area. And then at 9 years old, she started having generalized seizures and an enlarged left lateral ventricle and extensive subarachnoid air over the left hemisphere, and her left hemisphere was totally atrophied. And then at age 15, she had about 25 seizures a day. And then when she reached adolescence, she had 3 brain operations, and they removed the left hemisphere surgically, and this caused unchanged language abilities and improved behavior, and then it made her also seizure free. And then for 25 years, she worked at the library until she reached 50, and she was married, but now she lives alone.
Yeah, yeah. So, and just for reference for anybody who doesn't know, cot is the word for crib in New Zealand. So it was her crib. By 10 months, they can kind of like climb over the side. So my guess is that's what happened. True to every parent's worst nightmare. Okay. Yeah, great job explaining, getting us set up here. All right, what were the symptoms and the testing results? Hmm.
She had purple thing. And a test for
Yeah, so a lot, especially for someone so young. I mean, in some ways, with her seizures and whatnot, she reminds me of HM, right? He had a lot going on as well. Excellent job. All right, so diagnosis. Definitely. Yeah. I mean, if you only have half your brain to look at stuff, right? It's going to be hard to process everything. All right. How about treatment and effectiveness?
like she had her last operation at age 7. Obvious that the brain took over.
Yeah, and obviously a hemispherectomy is a last resort, right? You only do it if there's like just a massive tumor that is taken over, or a case like this where like the seizures are very lateralized, right? And you think by removing that half of the brain, you're going to improve their quality of life. You don't just go out taking out half of people's brains. Believe it or not. Alrighty, impact on life and family, which I realized I should have flipped with treatment ineffectiveness, but that's okay. Right. Well, and as you kind of mentioned, like stress off her, right? She was able to not only form friendships, but to form a romantic relationship, right? I mean, which just makes sense if you're thinking about it in terms of like you spending all your time in the hospital. You're not gonna be able to make friendships, right? Things along those lines. Give me just a second. I'm gonna sign off here. There we go. Perfect. Yeah, so I really like this case because it's sort of like a combo childhood and adult case, right? Like most of the people we've looked at we only kind of get the adult perspective, but we basically get the childhood perspective here as well. And this is not the exact case of what Kate experienced because it's about traumatic brain injury, although I guess she did have 2 falls, but her treatment was focused more on her seizures, right? But this is a pediatric ICU talking about how they help kiddos with TBIs. So sort of interesting to think about.
My name is Ben Tachak and I'm 8 years old. I like to play soccer and I like to play basketball. I like eating chicken tenders and fries.
As I always say to people that never met him, I said, if you could start with him, you'd have 10. He's that delightful a kid. He always has been. He's got the best disposition.
That's a good one. He's such a fun little boy. He's just pretty vivacious, loves sports. He's sweet. He's really kind, just really playful, just an absolute darling little guy.
When Ben Sawchuk came into the pediatric ICU at Hopkins, he came in as a head injury. He was riding his bike and got hit by a car, and he was critically ill. He was one of the sickest brain injured patients that we have seen. He came in a coma, so it was not medication induced. That was the injury, the severe injury to the brain put him in a coma.
You don't know when somebody's in this type of a coma whether they will come out of it or not. You don't know if they do survive, what return of function will there be? Will they be able to walk? Will they be able to talk? Will they be able to feed themselves? Will they be able to remember anything? Will they be able to interact?
Dr. Kristen Nelson, she was amazing. She stayed round the clock with him because, as she said, you know, Ben needed me last night.
You really just have to monitor things and do things very frequently, because if you don't, the swelling and the injury in the brain can get worse. And it's that first 48 hours that's really critical.
And it was obvious to me that she wasn't sleeping. She was sitting there fixing this. And that's very clearly the reason why he survived.
We say they kind of checked their egos at the door because it was all about Ben and it was all about his life and his survival, and they worked amazing hours and they were very dedicated to him, and I can't say enough about them. I mean, they saved his life. After about 3.5, 4 weeks at Hopkins, he was released to start receiving therapies. And for the last 4 or 5 months here in Baltimore, he's received amazing therapy and continues to make progress daily. They got him back on a bike very soon after his accident. It's a different type of bicycle, and he's been riding, I'd say, every week since he started his therapies. It's the favorite part of his day.
Because of our really positive experience that we had with the Johns Hopkins Children's Center, we said, you know what, they've got to see the magic that they had a hand in, right? And the miracle of, you know, this kid. So we brought him back there. To see him and the staff, the nurses that took care of him 24/7, the doctors who, you know, really were worried that he actually might not make it. but does. And to see their reaction, it was an amazing experience for them and for us.
That's one of the benefits of working here, is you get to work on a team where excellence is a pursuit.
We have the
And obviously then it becomes a plug for Hopkins, but I do have to say, if you're gonna have a traumatic brain injury, like having it in Baltimore is not a bad thing because you have access to Hopkins, which is one of the best facilities in the world, so. Not that I would wish that on anybody. Alrighty, so thanks for walking through the case study. I just really like that as an example of recovery of function and especially of plasticity, right? The fact that she didn't have an entire hemisphere of her brain and yet recovered a lot of those functions really suggests that, as you all said, the other hemisphere took over and adapted. And again, it just sounds so bizarre. But we didn't know about this till the late 1990s, right? So like just over 20 years ago. And they were just shocked when they discovered that adult brains can manufacture not only new neurons, but also glial cells, those helper cells. They can manufacture those as well. And everything is affected by experience. They looked at it in the olfactory bulb and found that they can do this through mitosis. They looked at it in the hippocampus and found that the hippocampus can develop new cells from granule cell layer and the hilus. And just plasticity in general, we can study through people's behaviors. We can study it through physiological organization, synaptic organization, the molecular structure, that mitosis of how things are replicating. And humans in general show a pretty good ability to adjust to a rearranged world. Again, as we saw with both Kate and Gabby Douglas and this kiddo in this video, right? That essentially they figure it out. I believe in one of the other things we looked at, they mentioned prism glasses. So you can put these prism glasses on people that shifts their view, right? They shift their vision. And people who have those on, even for a relatively short amount of time, can adjust pretty quickly, right? So there's a lot of really great things that can come right from plasticity. Before the late 90s, there was debate, like people just thought it didn't exist, but now there's little doubt that we can produce new neurons. But they don't seem to just like replace the old ones. Everything is affected and influenced by your experience, and those synaptic connections grow based on your experience. However, there are negative aspects of brain plasticity. Can anyone think of one off the top of their head or guess one off the top of their head? What might be bad about having a brain that could grow and change as a result of experience? Yeah, Kim.
Does it ever happen? Or is it?
Yes. Yeah. So like one of the examples your book gives is exposure to drugs. Right. And depending on the drug, most of them you would have to be, several extreme usage, that type of thing. But like things like ecstasy can affect you after one use. That's why when I teach adult psychopathology, it's on Dr. Myers' list of like, don't ever do these. I have like a bizarre list, like things not to do. Cocaine, probably meth, definitely ecstasy, because it just makes you basically produce all your neurotransmitters at once, and then you're in a deficit for like weeks afterwards, right? Yeah, so even without pathology, we can see that. And especially repeated exposure to drugs produces alterations in the length of those dendrites that makes the connections between neurons, and also in the density of your spinal column, your spinal cord. You can experience pathological pain. So a lot of health psych now is focusing on psychological reasons for pain, because there are people who will have recovery of function physically, even in, let's say you had to have like a knee replacement or you were in a car accident and like everything's been stitched up, there should be no reason for you to have this pain and there's still an excruciating pain. One sort of, again, extreme example of that is phantom limb syndrome. So if you're not familiar with what that is, let's say you have to have your arm amputated at the elbow, right? A lot of people who have that still, because of the way the nerves are, still feel like they can experience pain in the limb that isn't there. Or like they feel like, say, their arm is like really cramped up. And they've done some really interesting interventions for this, including, I'm trying to like make sure I'm on camera here, taking your existing limb, putting a mirror next to it, and so it's almost like you could see you have a second arm, and then like unfolding that one, and like in your mind goes, oh, okay, it's not folded up and cramped anymore. But you know, obviously not fun. Things like epilepsy and dementia are other examples of how we can see neuronal changes, again, in not good ways. You can have interactions between experience-dependent changes. So for example, environment and drug interactions. Stimulant drugs can block dendritic changes seen after exposure to a complex environment. But complex environments themselves also change how you respond to drugs. So one of the most interesting things about drug use is that it operates a lot on the principles of basic learning, right? So when you start your process, whether that's, you know, rolling a joint, even pouring yourself a glass of bourbon, right? Cooking up your crack cocaine, right? Your body already basically is like preparing for the drug. And so because your brain has sort of created this preparedness, if you use the exact same amount of drug you've been using for a while, but in a new environment, you can overdose. And in fact, this is what they think happens to a lot of celebrities, because if you look at news reports, I think of people like Corey Monteith or Heath Ledger, they're usually overdosing in places that are not their home. So like a hotel room, or I think Heath Ledger was in like one of the Olsen twins' apartments or something because they were friends. And so that obviously is a bad example, right? Stress can also affect your brain. It can change dendrite morphology. It can interfere with neurogenesis, the creation of new neurons. And again, it's going to interact with these experience-dependent changes in the brain. And then what we'll see is compensation. So sometimes what you're doing is just adapting. So like with your new ability to function or not, right? And so your book gives the example of three-legged cats or three-legged dogs. If you've ever watched a three-legged animal, right? They don't recover the function. They don't grow a new leg. I mean, there are like insects that can do that, right? Or like lizards can grow their tails back. But, you know, dogs and cats cannot, but they adapt, right? They get to where they can walk and run almost as well. My daughter is obsessed with Dodo Kids videos, which are just adorable little stories about pets that were adopted. And like, there's one little dog who was born without any front legs. And he learned to like jump up on the couch like a kangaroo. Basically, like it's really amazing what we can adapt to, right? But just like that's distinct from recovery of function, right? It's obviously just as wonderful and fantastic, right? But it doesn't, again, mean the dog grew front legs that it never had. So if you have damage to the motor cortex, it's going to be, they think, 23 to 40 days. And that's before you start doing anything like your PT that they showed this kiddo doing, right? Things along those lines. You've got to return your reflexes. You've got to grasp what was facilitated by other movements. You might have some rigidity you need to overcoming, things along those lines. And only about 30% of patients who have damage to that area have a full recovery. most have at least a partial recovery. So aphasia, so head injury patients show the most rapid and most complete recovery. Deficits are least severe in anomic patients and most severe in people who have global aphasia. I mean, that just makes sense intuitively, right? If like every part of your language ability is affected, yeah, it'll be harder. You can progress to other stages with recovery, but you sort of plateau, essentially. And that's what we saw with Gabby Giffords, right? That like, yes, she had gotten better in like the 10 years since what happened, but she was never going to have full recovery of her language abilities, right? Younger patients have better recovery, and there are some language areas in the right hemisphere, and those tend to be the most resistant to damage. So those, as they sort of did with Gabby Giffords, those can be used to compensate, and especially by doing things like activating singing and other musical things. So if you develop any sort of traumatic lesions, so we see this especially in combat veterans, but also sports players. We typically think of the NFL, but certainly any contact sport, you can get these. Hockey, right? Lacrosse. There's more research now into soccer players with the headers, perhaps having more concussions than they even realize. This kid with bicycling, BMX type sports, equestrian type sports, right? But in veterans, when they were recovering after brain injury, they found about 4% of people had recovery from motor deficits, 36%, so over a third, had recovery from any sort of somatosensory deficits, 43% had recovery from visual deficits, 24%, about a quarter, recovered from dysphagia, but unfortunately, 50% of veterans in this particular study had no recovery at all of the functions they lost from TBI. There's a couple reasons for that. One is that we have learned a lot about TBI in the past, I don't know, 15 years or so. And no, 20 really, because I'm thinking of the Iraq and Afghanistan wars really started in like 2002. So, but largely combat veterans who get concussions, especially if they don't lose consciousness, people ignore it. They just get up and brush it off. Sometimes you're not in a situation where it's safe for you to get any kind of concussion assessment, right? Like if an IED exploded and then there's somebody raining mortars on you, you can't just feel like, let me sit and do like a neuropsych assessment, right? Sometimes it just necessitates that you keep going. And so because of that, they often weren't assessed. They just sort of went about their day. It's one of the worst things that can happen, right? If you have any sort of concussion, you don't have to keep the person fully awake like they used to think, right? But you should definitely be testing them. The other thing is, again, even when I was there in 2009, 2010 at the VA, they were still trying to decide what they considered a TBI, like even a mild TBI. They were like, well, does it count if the person didn't lose consciousness? And it's like, why is that the distinction? Like if they were hit in the head or they suffered a concussive blast, right? It shouldn't matter. So some of them were just getting no access to care. And as we saw both with the kiddo in the video at Hopkins and with Gabby Giffords and with Kate, right? It really is access to care that helps facilitate that recovery. I mean, and that's true no matter what kind of injury you have, right? I think of the NFL player who had the cardiac incident on the field last year, and he's like doing really great now, right? But that's because he got immediate, really good quality care, right? Let's see. If you have any kind of surgical lesions, have to have surgery, and again, maybe for epilepsy or things like that, they might sometimes purposely lesion you. you can sometimes just lose certain abilities altogether. So for example, if you have dorsolateral frontal lesions, you never recover your ability to do the Wisconsin card sort, which is one of those executive function abilities. Right temporal lesions, you've no recovery in doing the Rave figure, that complex figure that we looked at. Bilateral temporal lobe removal, no recovery from that. However, if you have left only temporal lesions, we see significant improvement after 5 to 20 years. So a lot of this can come into play. Not surprisingly, there are a lot of sort of demographic variables that can affect how well you do. So if you just look at return to daily life, like if your measure for has this person recovered or not is, have they gone back to work, or are they employed, even if it's not where they used to be employed, there's about an 80% recovery rate. I mean, I don't know how helpful that is, because I don't know how much of an indicator of recovery that is, because most people are just going to have to work in order to live, right? Like most people do not have generational wealth just sitting in a bank account, right? Ready to do things. However, we know that social relationships and leisure activities suffer. I mean, that's one of the reasons why I always ask about impact on life and family on the case studies, right? Is because some of these cases, it was really profound. Oh my gosh. The woman whose kids ran away, that one gets me every time we talk about it, right? You know, and spouses or parents, it can really be difficult, and in particular, especially if they're a kid, but even if they're adult, it is the relationship with their siblings that tends to suffer the most. So measures of recovery often overlook coping mechanisms the person is using. Are they doing health things like taking walks or meditating, or are they self-medicating with drugs or alcohol, things along those lines, right? We are not always looking for that. Age is a really important one. We know that younger patients have more recovery. They just have more energy, probably more plasticity, although we're still figuring that out. We see that in certain instances, not every incident, but women tend to have more bilateral activation in their brain, which facilitates recovery, facilitates that plasticity of one hemisphere compensating for the other. And then the really interesting thing is if you're left-handed, because our world is right-handed, right? So like, even if you're left-handed, you're still going to like use silverware in the same way as a right-handed person, right? And you might even be taught to play a sport more right-handed than left-handed, right? Depending. So they have more flexibility. They're less lateralized in general. And that's an advantage for recovery and recruiting those undamaged regions after the brain injury if you already have those connections, right? People who have higher intelligence tend to have better recovery. My guess would be that has nothing to do with actual intelligence and everything to do with like a lot of people who are intelligent have more resources, right? We know that, for example, growing up in poverty is an indication of poor intelligence, not because it causes you to not be smart, but because you don't have access to a parent who can read to you, right? Or tutoring or things along those lines. So my guess is that's more of a resource thing. People who are optimistic, outgoing, and easygoing have better recovery. Hope has been shown in all manner of physical and mental recovery to be a big part. Like if you believe there's a possibility for you to recover, you're much more likely to recover. But you know, if you don't, that can be a problem. I could also see, again, we just talked about how important quality of care is. And I mean, again, we hate to think of the fact that like healthcare providers can have unintentional bias, but they can. And I can just imagine that like the healthcare providers want to spend more time with the people who are outgoing and easygoing, right? And optimistic. And even if it's just, you know, a minute longer each time, those add up if you're doing a bunch of PT sessions, right? And so there's lots of different ways that we can help people recover. So we know that social interaction and environmental stimulation are important. So for example, my students who do internships at the assisted living facility we work with, Our Lady of Perpetual Help, part of their day is just doing one-on-ones with residents, just sitting down and talking to them, because unfortunately, just due to the nature of being in that type of facility, these folks don't get visitors every day. They might not even get visitors every week, right? So just having that social interaction can be really helpful to those folks. You can do movement therapy. Not only is it going to help the muscles, tendons, whatever, in any part of your body that was injured, but motor training also stimulates those plastic changes in the brain. So that's important. Cognitive rehabilitation can be done, but challenging. You have to think about, how can I do something like in my office or at bedside with this patient that will translate to something helpful outside the hospital, right? And that's why sometimes the most helpful people to these folks are occupational therapists, who are the folks who teach them how to like use bars to get in and out of the shower or bath safely, right? Things along those lines. Medications. There are certain compounds that can facilitate that plasticity change in the brain, and they work by reducing inflammation primarily. You can also do brain stimulation. So there is deep brain stimulation that's also used to treat depression, where you essentially implant like a pacemaker, but in the brain. For most brain injuries, that's not going to kind of work in the same way. But one that's been really showing promise is TMS, which is transcranial magnetic stimulation. And they actually do this over at EVMS. And you can, again, use it for depression. But it is a big magnet that used to sort of aim at the brain, and it stimulates it, and it can help with recovery. In rare cases, you can actually do brain tissue transplant or stem cell induction. So again, when we talked about Parkinson's, we talked about how a lot of these are controversial because they use fetal stem cells, right? Especially in a post-rural world. God knows what's going to happen with that. God knows what's going to happen with like people going through IVF, right? But they're working on cultivating stem cells from the individual's body, which would be less controversial. Alrighty, that's actually all I have for recovery of function. Do you guys have any questions, comments about it? What I was thinking I could do for the last 15-20 minutes of class today, 15, that clock is slow, is to give you all time to work with your groups. And obviously if your group is not here, you can head out. I was just looking at Kim like, no, your group's not here. But to touch base, if your group is here, and be working on your outline or just other aspects of your group project. And if not, I will see you all on Wednesday. Starting Wednesday, we're going to be touching on psychiatric issues and how those are related to the brain. And Day, I'm just going to let you sign off, and I'll talk to you later.